This is Rebecca McCall. My topic for leading and managing others is coaching and disciplining staff. Part of being employed is needing to abide by certain guidelines. Within every place of work, there are rules, policies, and expected behaviors put into place. There are reasons for each rule, policy, and expectation, and if these are not followed, the issue must be addressed. The reason why the healthcare field is different is because any deviation from these rules, policies, or expected behaviors can have a direct negative effect on quality of care or patient safety. Addressing these issues can be the most challenging part of a manager's job, but is of utmost importance. First, I'm going to talk about coaching. Coaching is the coming alongside of an employee in a 5 to 10 minute session of one-on-one time with the goal of eliminating or improving a performance issue. So the plan is to address an issue when it arises, kind of sit down with the employee, talk it through, try to prevent a larger issue from surfacing. This is a very important part of managing, but something that's often overlooked and kind of pushed to the side until a bigger issue arises. So the goal of coaching, the why, is to change the behavior. An article that I read by Batson and Yoder discusses the fact that nurses kind of like to hear feedback. They like to know how they're doing. They like to improve performance if there's an issue, especially if they're not really aware that an issue is there. They like to have that brought up to their attention. The goal of coaching is to improve patient safety and satisfaction, and also to provide accountability through change and growth. So how do we coach? I'm going to kind of talk through an example of bedside reporting, something that we've been trying to implement at Lancaster General. So in these 6 steps provided by our textbook, the first step is to state the issue in terms of behavior. For example, a manager will call a nurse into her office and say, "I've noticed that you haven't been giving bedside report." So in step 2, the instructions say to give the reason why it is an issue. So the manager might say, "We try to give bedside reports so that the patient is informed of their plan of care. Patients like to hear what's going on with them, and it gives them an opportunity to ask questions and be involved in their care." Step 3 is to try to understand the reason for the problem. So the manager may say, "Can you tell me why you haven't been giving bedside report? What's the barrier?" To try to understand why the nurse isn't giving bedside report. Maybe the nurse is uncomfortable speaking freely in front of the patients. Maybe there's another reason. So just to kind of talk about the why. The 4th step is to brainstorm ways to solve the problem. So the manager and the nurse can talk through ways to maybe get over some of her nervousness about talking in front of the patient freely and giving a report. Maybe they can practice doing a mock bedside report, and just try to come up with other reasons or other ways to improve this or solve the problem. So the 5th step is to decide on steps to solve the problem. So in this example, the nurse and the nurse manager may just say, at least one time a day you need to go into the patient's room during report and give a bedside report. This is really important and it needs to happen. And the 6th step is to schedule a follow-up meeting to discuss progress. So in a week or 2, The manager and the nurse may sit down again and talk about whether or not she's been giving bedside report, how's it going, how are you feeling, has the behavior changed at all. Coaching is not punitive, it's not supposed to be blaming, it's supposed to be a way to educate and improve behavior. Coaching does not always need to be used to improve behavior. It can also be used to recognize positive behavior. A manager can come alongside a staff member and let them know how good they're doing. It can be used as a leadership developmental tool to help coach a staff member that the manager sees as a potential leader, to help them be more confident and competent as they proceed towards leadership. A leader, like a manager, may kind of groom one of their staff members to take over for them, or someone that they see fit for the position if maybe they're planning to leave the position in the near future. Coaching is beneficial to the whole team and helps the team work together and to feel like they're doing a good job. So what happens when an actual violation has occurred? A rule or regulation has been broken. Maybe coaching hasn't worked. A behavior is continued. Staff member needs to be disciplined. So what exactly is discipline? Discipline is very similar to coaching in the fact that it's trying to correct a behavior through teaching and encouraging. But it's different than coaching because there's a more formal procedure to dealing with a break in rules or regulations. Discipline is necessary for the proper functioning of any team. Whenever there is a deviation from policy or procedure or rules, needs to be addressed. If it's not addressed, the issue may permeate into the rest of the staff and become an even greater issue amongst multiple people. Discipline should be a clearly documented policy. There should be written rules, regulations, expectations as a part of any employee's hiring process. A code of conduct, for instance, that clearly states what the rules are and what the consequences are. Any discipline should actually be a staged process, which is referred to as progressive discipline, and I'll talk about that on a further slide. Why should we discipline? Why should a manager take that time to discipline a staff member? The reason is because coaching has not worked. A gentle approach hasn't seemed to resonate with this employee. Quality of care or patient safety are in jeopardy. There is an issue going on that can potentially cause a greater problem, and this behavior just downright needs to change. It's not acceptable. As I stated before, discipline can be a difficult part of a manager's job. So it's a good idea to kind of have a plan with discipline. Our textbook goes through a 10-step plan for how to discipline effectively. I thought it was pretty helpful, so I'm going to read through that. First, it's important to get the facts. You can't discipline unless you really know what's going on. To understand the background, to have maybe some input from other staff members, and also from the employee themselves to make sure that everyone's on the same page. The second step is to stay calm. It's easy to get emotional when dealing with an issue with an employee. The third step is to be consistent. Third and fourth step are really to be consistent with rule enforcement across the board with all employees. and also with the penalties. Discipline should be done in private. It should be a one-on-one meeting. It's just unprofessional to address issues with a certain staff member in front of other people. The sixth step is to be clear about the offense. Clarity is of utmost importance so that you're all on the same page again. It's also important to listen to the other side of the story, but as step 8 says, do not let it get personal. Sometimes an employee may talk about very personal things that are affecting their work, which they truly may be affecting their work, but you also need to be able to separate that from the expectations of a job. Number 9 is don't back down, which also may be difficult because if somebody is having a personal issue and getting emotional, you may want to take a step back and try to, or have the desire to maybe not do the discipline that's necessary. The 10th step is to inform HR of the offense. Human resources always needs to be involved in discipline so that it's properly documented. They need to know the outcome and any details throughout the process. So on a previous slide, I referred to staged discipline, which is also called progressive discipline. Progressive discipline is the process of managing repeated violations with increasingly harsh warnings. So when a behavior is not improving, the employee will probably first get a verbal warning, and if the behavior continues to not improve, they will get a written warning. And if they're still not changing behavior, the employee may be suspended. And if, of course, the behavior is still not improving, the employee will probably be terminated from their position. So this step process is also probably based on the seriousness of the offense, and this will depend on wherever you work. There should, as I said before, be a code of conduct, and within that code of conduct there would be penalties for breaking that code of conduct. So for example, an employee continues to eat their lunch at the computer in the nurse's station while they're documenting, knowing full well that this is not allowed. So a manager would see this going on, tell the employee, hey, you know what, you really can't have food out here. Can you please eat in the break room? But the next day, the next week, whatever it may be, this nurse is hungry again while she's documenting and is eating again at the computer in the nurse's station. The manager may then proceed to write a written warning, and so forth and so on to suspension and termination, which I would hope that eating at a computer wouldn't lead to termination, but that the behavior would be corrected throughout this time. As it says on the slide, this progressive discipline doesn't necessarily have to be a negative thing, but it can be more of a time of mentoring, according to an article that I read by Miller. However, if the offense is more severe, like stealing narcotics from the Pyxis machine, some of these progressive penalties may be skipped and the employee may be more quickly terminated. Here is a short video clip about progressive discipline. It follows the story of this nurse who just isn't doing his job well. It's made me giggle a little bit. I will put the link in Blackboard, and I hope it works. This slide shows the website for the Lancaster General Hospital Code of Conduct. It's kind of interesting to look through. It gives clear policies and procedures, and expectations for staff, along with the statement that disciplinary action will be followed if these policies are not abided by. So now comes the hard part, termination. Termination happens as the final step in progressive discipline when this employee is just not getting it. They aren't changing behavior, they're not improving behavior, it's just not happening. The employee needs to be fired. So 6 basic steps are listed here for termination. The first and the last step both involve human resources. As I stated before, they just need to be involved in this discipline process. So firstly, inform human resources of the plan of termination. During the meeting with the employee, the reason for termination must be stated. The third step is to explain the process of termination as far as benefits and so forth. The fourth step is to, again, stay calm, not get emotional, do not get upset, just state the facts. Fifth step is to arrange for security to escort the employee out of the building in case they become upset or violent in any way. Hopefully they won't, but it's just a precaution. And as I said before, the last step is to report back to human resources how the meeting went and to let them know that the termination has been completed. So this completes my presentation on coaching and disciplining. I hope that it was informative and that you were able to learn something. Thank you.